in. Hi, my name's Johnson and I'll be your nurse today, and your name is?
Jordan Jones,
And your date of birth?
September 6, 1995.
Nice to meet you, Jordan. And I have an IV, or an order for an IV solution to give to you today with an antibiotic. Are you aware of this?
Yeah, I'm getting it for my infection.
And we have consent to do this?
Yeah,
Okay.
I already signed it.
And have you had any past reactions before?
No, not that I know of.
Okay. Well, I'm going to get the IV solution prepared for you, okay?
Okay.
Okay. So the doctor has I'm looking at the record, and the doctor has ordered for 1,000 milliliters saline. And I'm looking at the bag, and I have normal saline, 1,000 milliliters. I'm looking for any holes, bubbles, if it's cloudy at all, and it looks to be good. So I'm going to get some primary tubing and hook it in, twisting. Okay. Make sure the clamp is closed. And hang it right here. And next we're going to prime the tubing by unclamping. Or we're going to make sure this is halfway full first. And it is. And then we're going to unclamp it and prime it. And I'm checking for any air bubbles in the hose, and I see that there isn't any. I'm going to keep this clamped down and hang the end up here. Next we'll prepare the antibiotic, and it's in a 50 milliliter solution. And I've checked the I've checked the drug guide, and it says that it mixes with normal saline, and the route and the administration and the rate all seem to match up. And the solution looks good. So I'm going to apply the secondary tubing. Okay, make sure that this is clamped. And then I'm going to prime the secondary tubing by filling this halfway and unclamping this. And then make sure there's no bubbles in this. Keep this closed. Hang that for now. Okay. And then do the piggyback method. Okay. Make sure it's hanging and not touching anything. Okay. Now we're going to start the IV itself. And we start by looking and palpating. And I've already performed hand hygiene. And I feel a good vein here. So perform hand hygiene again. Put gloves on. Oops. I'm gonna put the tourniquet, actually,
Hi, I'm Monica. I'm going to be your nurse today.
I'm gonna clean the area. And what I would have done is I would have put a tourniquet on before actually palpating for a vein. Make sure the area is clean before prep.
So, I'm going to go ahead and get
Wait for that to dry.
solutions primed and ready. And then we'll go ahead and start
I have a 20 gauge needle here with a catheter.
obviously, check the bag, make sure there's no rips, tears.
After it's dried, I'm going to put the tourniquet back on. Okay. And we're going to get the catheter ready. the saline lock. Okay. Now I'm going to make sure that the bevel's up. I'm going to pull the skin taut, and I'm going to make sure that he relaxes before we go. I'm going to poke it in just slightly at level with the vein and wait for blood return. And I see that there's blood return, so I'm going to advance it 1/4 of an inch further in. And then I'm going to pull back on the catheter and push this in at the same time. Okay, I'm going to get the sterile gauze pad and place it underneath to absorb the blood. Put the saline lock in. And then I'm going to inject the saline and check for patency. And then I keep that positive pressure and pull the saline lock off. I'm going to put this into the Sharps container. And just for, I'll clean my hands again, put gloves on again. And we're going to have a sterile dressing, and we're going to place it over, and I completely butchered it, so I'll just get another one. No, just keep recording. Are you recording?
Mhm.
Okay. I need another one. Do we even have any?
I think there's one on the table.
Well, I got this big one, but
That'll work.
always just make sure you have one. Take the tourniquet off. Make sure to cover the bell of it. Oh, this one's tight. There we go. Keep that covered. Throw this away into a hazmat bag. And tape. I'll take this down. Okay. And then get rid of these gloves.
Hey, Mr. Smith, I'm back. The doctor ordered antibiotics.
Hold the tubing.
How's that saline solution treat you? Good, okay?
We'll make sure to clean this with alcohol. And clean the site with alcohol. And then insert.
Sure. I would want this.
Okay. I'm gonna turn the catheter on. And the order is for 125 milliliters an hour.
This is going to infuse over the next 30 minutes. It's going to give you
And the volume to be infused is 1,000 milliliters. And we'll clear that. And then we'll go to secondary. And the volume to be infused is 50, so it's at a rate of 50 milliliters per half hour, so we'd go to 100 milliliters per hour. The volume to be infused is 50, and we will run. Making sure that this is on client.